We want to bring in Eric Wallis. He is the president of Henry Ford Hospital here in West Bloomfield. Thank you so much for being with us. We always appreciate having you here on the show.
Thanks, Ronnie. I appreciate you guys letting me come back and taking on this really important topic right now.
So I did have someone who recently, they had a baby at your hospital. Loved the experience. I know the mother had to be tested for COVID-19 prior, but they said they didn't really, they had a good experience. They didn't see a lot of craziness, but we're hearing of chaos coming back to some of the hospital systems. Do you want to bring us up to date on the status of where things stand here at Henry Ford Hospital in West Bloomfield?
Sure, I appreciate that, and I would say one of the things that we always want to make sure is that people don't feel the chaos that maybe we're dealing with. I think if you look at where we were back in March and April, at times we had nearly 150 COVID positive patients here in our hospital. And really then as we went through the summer, we kind of stabilized with, less than 10 or so patients on a pretty regular basis. Over the last 2 weeks, we have seen that number, unfortunately, start to climb dramatically again. Today, we're back up over 70 COVID positive patients here within the hospital. When you look at the Henry Ford Health System as a whole, we've got approaching 400 COVID positive patients in our hospitals. And so, yes, unfortunately, we are seeing a pretty significant resurgence. And really, even for patients that are coming to our emergency department, we're seeing a much higher rate of folks that are coming and needing care, and unfortunately, even testing positive. We've seen that positivity rate of the folks that we're testing now many days at or above 20%, which is very high. At really what we want to see is less than 5%. And so we are very concerned. We are still, I would say, running most of our normal operations. But we are seeing a lot more COVID in the community at the moment.
So with that, before we get to the testing situation, how are you treating the patients that come in now compared to at the beginning of the crisis?
So it's a great question. I think, honestly, as most people know, this was a brand new virus. And so when you go back to March and April when it was first emerging, we really didn't have any treatments. It was a lot of using thoughts and ideas and treatments that for other viral diseases that we were, experimenting with and trying different things to see what would work. The good news is now, not only for here at Henry Ford, but across the country, a lot of that work has been done, and so there are much more prescriptive treatments. And so the good news about that is we are seeing people get less ill while they're here in the hospital. So we're seeing fewer patients that require ICU level of care, but we're still seeing a lot of folks who need to be in the hospital for a few days. And so, very well publicized. We know that remdesivir as a medication makes a big difference for given to patients very early on. We know that steroids make a difference when we give those to patients early on. And so I think right now I would say we have a pretty good feel for what the course of treatment should be. But that unfortunately doesn't mean that we're still not seeing some people get sick, and we are still seeing some folks that wind up in our ICU and wind up on a ventilator as well.
How does an individual, sorry, Tyler,
That's good.
How does an individual know when to go to the hospital versus like an urgent care or their primary doctor?
Yeah, I think, anytime, and a lot of folks obviously have heard, signs and symptoms, and really what we encourage folks is that when you start to feel not well, when you start feeling, most of us have had the flu or had a really bad cold, if you started to notice that you have lost your sense of taste or smell, that's a very unique thing to COVID-19, we encourage folks to call their primary care provider first. Based on their symptoms, their provider should be able to direct them to what's the right level of care. Certainly, if you're having trouble breathing, if you're having chest pain, if you're noticing signs and symptoms of stroke, we want you to call 911. So I think that the rule of thumb is if you notice that you're not feeling well, if you know that you may have been around people that aren't feeling well, certainly give your primary care doctor a call and they can direct you to what might be the right level of care. But if in doubt, if you're not feeling well, if you really are feeling ill, and you feel like you need some help emergently, please come to the emergency department, and we'll make sure that you get the care that you need.
Eric Wallis joining us on the Oakland County Megacast. He is the president of Henry Ford West Bloomfield Hospital. And Eric, over the last couple of weeks, as we've seen the COVID cases nationwide rise, and you've spoken earlier on in our interview today that we have seen a steady rise in COVID cases coming into Henry Ford West Bloomfield Hospital. The concern at a greater level across the country hasn't necessarily been that there won't be enough beds for COVID patients, but that staffing is going to be, in this particular wave of COVID-19, of greatest concern. What is the status at Henry Ford West Bloomfield Hospital as we're seeing these cases steadily rise coming into the hospital? How is the status of staffing, and should this continue to get more severe in our local area? Is Henry Ford West Bloomfield Hospital prepared, staffing-wise, to shoulder that burden?
Yeah, I think so. That's a great question, Tyler. I think what you're seeing is back in the spring, we had the advantage that there were only certain pockets of really severe COVID outbreaks around the country. And so, we even benefited here at Henry Ford West Bloomfield with nurses from the Cleveland Clinic coming to visit us to help out in our ICUs. We had what they call traveler nurses that are usually, go around the country and work in different places. We were able to recruit some of those folks to come and help us. The challenge that we have right now is that we're seeing these COVID cases rise across the entire country. And so the resources that we had that could come in and help us aren't there now. And so, yes, we are much more concerned about that, making sure that we have the internal resources. I think right now I would say I feel comfortable with where we are. We have contingency plans in place. We are working with our own internal team members, and frankly, the benefit of being part of a healthcare system like Henry Ford is that if we need to shift resources from one facility to another, we certainly can do that. But we're spending a significant chunk of our time over the last couple of weeks making sure that we are matching the resources that we have from a staffing standpoint to where they're really needed based on the volume of patients that we're seeing. So, I think right now we're comfortable with where we are. We haven't had to jump back into kind of our extraordinary circumstances or alternate staffing modes that we had to use in the spring. But, I'm certainly worried about that if we see this, spike get back to that level, we will certainly be challenged.
Yeah, because one of the big issues back in the springtime had to do with the fact that you had to, for the most part, shut down hospital operations for emergency procedures, where that's where hospitals really make so much of their money, and it helps your bottom line. Are you concerned, and are you prepared if you have to go back in that direction? And when do you actually make that decision?
Yeah, so it is something that we're actually talking about on a daily and weekly basis about, do we have the resources available to maintain what we would call, quote unquote, our normal business, those elective or non-urgent kind of procedures, and deal with the COVID patients that we're seeing as well. Again, the benefit is that this time around we've got some experience. We have protocols and policies in place that we feel very comfortable being able to keep everybody safe. But there certainly is a point if that surge continues to grow that we may have to start to pull back on some of those non-time sensitive kind of cases. We have not had to do that yet here in West Bloomfield. I know at least one of our sister hospitals has had to slow those non-time sensitive cases, and we're hoping to not get back there ourselves. So, but those contingency plans are absolutely in place. And we are currently looking at all the cases that are scheduled, out over the next week or 2 weeks to say, if this continues down the wrong path, which ones of those will we postpone first?
How does this work when it comes to testing for COVID-19? We're hearing now there's starting to be a bit of a shortage in some of the testing and the testing supplies, but also a backup at the labs in order to get these results back and get them back in a timely manner so that they actually have an impact. Where does that stand there at Henry Ford with not only your patients that are coming in, but also with your staff members as well?
Yeah, so right now, the Henry Ford system, we can process about 1,500 COVID tests a day. We are certainly doing more than that at this point. So unfortunately, what we're seeing is really through most of the summer, we were able to turn those tests around in almost 100% of the time in less than 24 hours. We're now out to probably closer to 48 in some cases. They are being prioritized based on how critical it is to get that information back immediately. We do have some limited ability to do what you would call a rapid test or an in-house test, and we're doing that for some of our folks that present for procedures, emergent procedures, where we have to know, as quickly as possible, but the supplies and really it's the reagents, the supplies to be able to run the test. We can swab people. We're in good shape on that side of it, but it's the reagents that allow you to actually get the result that is a little bit shorter supply. So far, I think we're hanging in there. The time has lengthened a little bit for some of those non-urgent results, but right now I think we're really close to we're kind of on the edge of what we can do and still turn around in a very short time frame.
Well, I know they're anticipating the numbers could continue to rise. Let's hope that these new restrictions help bring those numbers down to help hospitals such as yours across the state and across the country. Quickly, before we let you go, what's the status on visitors into the hospital? Have you changed your visitor policy yet?
Yeah, I would say that those are things that are frankly changing on a pretty regular basis right now as we have to reassess. So kind of every little uptick that we see, we're going back and saying, does it make sense? Unfortunately, we and some of our sister hospitals have seen a couple of instances now of patients who were in the hospital that were COVID negative, and then after visitors coming to visit them, a couple of days later being COVID positive. And so we are limiting visitors at this point. I just would encourage everyone, if you're thinking about coming to visit somebody at the hospital, go out to henryford.com. All of the visitor restrictions and hours and rules for each one of our hospitals are posted out there. And so, if they change, that's one of the first places they're going to be posted. And so anybody that is thinking about coming to visit a loved one, friend, family member, et cetera, I'd encourage them to go there first, look and see what the restrictions are that are in place. And that'll help eliminate a lot of frustration, because I can tell you today, we are certainly limiting visitors that come to the hospital to only one person per day. But I would guess that if this wave continues, if we start to see more, we might have to be more restrictive than that in the near future.
And visitors can mean so much to someone that is in the hospital going through such a scary health crisis at the same time. Eric Wallis with us here. He's the president of Henry Ford Hospital, West Bloomfield. I know that you just took over your position in May 2019. What a learning curve this has been for you, to not only take over the reins, but also during a pandemic. Any advice that you have from your background and your experience? You started out on the nursing side of the industry, that you want to give to college kids or maybe even high school students right now who are thinking of getting into the healthcare industry? Because one thing we will say, during the middle of the pandemic, I think it's really raised awareness about how important it is to have so many good people in the industry right now.
Yeah, no, I think it's still, and I know I'm biased, it's still the greatest health industry to work in. You have the opportunity every single day that you come to work to make a difference in someone's life. And so, whether you are a doctor, a nurse, someone who works in environmental services, someone who works in our food prep areas, every single person in this building has an amazing ability to make an impact. And so, as you mentioned, I'm a nurse by background. I tell nursing students all the time, there's over 400 different kinds of nurses. And so there's never a reason to be bored in your career. You have a world of opportunity in front of you. And as I've said many times to folks, if you just can't figure out what else to do, maybe you can become a hospital president.
Well, they definitely have a tough job. I have two nieces that are nurses, and my other niece is going into, public health there at the University of Michigan. So it's very much a needed profession and an honorable profession. And before we let you go, though, when it comes to actual staffing, let's say on your janitor side, there are so many other jobs in a hospital setting other than, the healthcare direct individuals needed to work with patients. Where does Henry Ford West Bloomfield stand in that area?
Yeah, I think one of the most important things to remember is there's really only two types of folks that work in our hospital. There are people who take care of patients, and then everybody else is helped to take care of the people taking care of patients. And so it's really, like I said, it's an amazing opportunity to make an impact no matter what department that you work in. I am extremely proud of our healthcare system in that we were really the first healthcare system here in Southeast Michigan that recently raised our minimum wage to $15 an hour. We are in the midst of an incredible pandemic, and I think for our system leadership to recognize that we have an obligation to make sure that people can earn a living wage when they come to work in healthcare is an incredible testimony to what the Henry Ford Health System thinks about its people. And so, there's some amazing jobs. There's great places to get in. We see so many of our folks who come in as environmental services or food and nutrition work team members, but then have the opportunity and work their way back to become nurses' aides and nurses and physicians. So it's a great place to start a career. And I think, like I said, the Henry Ford Health System has shown that our most valuable asset, the thing that makes us go, is our people. And so I'm very proud to work for this organization because of that.
Well, we so appreciate your time. We know you're extremely busy, and we wish you and your entire team the best of luck as we go into the winter months. And let's hope that we are able to flatten this curve over the next few weeks and the cases do not continue to rise, because I know that you and your team members are on the front line of this pandemic and the COVID-19 crisis. So again, thank you for your time and your expertise as well.